I am interested to learn that Russia is there's word out that Dolichol is now available in the supplement form. I've not used it, but it's available, and it comes from the Arctic larch, Arctic fir, the needles of the Arctic fir, and it's a Dolichol that's exactly like what we want. So that's when that is available, I'll naturally be interested in that, because after all, these are the two very important things that are inhibited by statin drugs because of the mevalonate blockade. And
well, with respect, that's interesting. I hadn't heard that it was
the
coming.
Dolichol. Well, usually we haven't thought much about Dolichols because you can't replace it.
Right.
There's no supplement for it, but there
is.
actually is, and it'll soon be available.
I'll keep my eye out for that one.
Yeah, the other things are.
Sorry for the interruption. What are the other ones?
Well, there are certain. Vitamin C is always cited as an antioxidant, and it is. And vitamin D is up and coming as an antioxidant, and we never dreamed of this 25 years ago, but that's one of its new functions that I'm interested in. And now vitamin E there's a new form of it called tocotrienol, and this is so important because for 60 years we've been using tocopherol, and tocopherol is a good antioxidant, but tocotrienol, which is just the other half of the vitamin E molecule, really, tocotrienol is a really 50 times more powerful antioxidant, and in addition, it has a special ability to improve. And let me see what I want to say. Tocotrienols, they not only give you 50 times greater antioxidation, but it also enhances the anti-statin things anyway. It even helps to produce some cholesterol. And it has a few other biochemical advantages that make it really attractive. So by all means, tocotrienol is the one. Now for the elements, there's only selenium and magnesium. Those are the two that are commonly involved as cofactors in various things. And selenium, we're still learning about that. What we've learned about selenium has only been in the last few years, and that is inhibited seriously by statins. And so that's one that's gotten a lot more study recently. And then what else? We have, alpha lipoic acid. I can't help but be sort of interested in that. And then there's carnitine. Carnitine is so important, but it only has to be used initially because that is going to tell you if you're able to metabolize fats adequately. Because we have to remember that 70% of energy for our muscle function comes from fats. So it's very important that that we have the ability to burn fats. And if we take L-carnitine and find that suddenly we are much better, then we have just proven that we need that the rest of our life, because we're one of these people who have a dysfunction in this capability. We don't have the means to properly burn fats at a muscle level, and instead of burning 70% fats, we're only burning 50%, and naturally we would get weak on exercise. So carnitine is useful for making a diagnosis, but if after 3 months of a good dose nothing happens, I would say you forget your carnitine.
Okay. That's great. And also with selenium too, it's a cofactor for the production of glutathione, which, I mean, you can't take glutathione supplements, but it doesn't work very well orally, so you really need to do it intravenously, parenterally, and and
But you
makes more
see,
sense for your body to make it than to take it as a supplement.
but there's so many of these supplements now. When you get up to a dozen or more, and you threaten some poor patient with this, it's going to cost him a lot of bucks. You wish you could be more specific. You wish you had the means of measuring all of these and treating only the ones that are low. And this is where we are today, trying to come up with packages that are meaningful. But I think that when you have a statin-associated muscle or nerve or even brain dysfunction, this is where you've got to go.
Excellent.
That's where the trouble is. I think that's where the trouble is. Of course, if it's cholesterol inhibition, you just take more eggs or take more cholesterol, whatever. But I'm not being. I'm talking the truth there. Eating more eggs. I can't believe I went 17 years and never ate an egg. I can't believe how gullible I was as a medical young doctor. I will march to that band of the cholesterol causation people. I just marched to them so enthusiastically, and talked at all the club meetings on the what you're supposed to say. I did everything I was supposed to do, and it was all wrong. And I can't believe that I was led astray. And maybe for 25 years of my practice, it was so bad. You have to look back and realize that you're treating cardiovascular disease erroneously because you're doing what you're asked to do.
Sure.
Well,
Well, you can only do the best you can, and you modify your views as you go along, and you uncover new information. So that's all you can do.
All of us suffered from that. We all listened to that. What amounts to brainwashing, the brainwashing that we got from 1955 on to just recently. We were brainwashed, and they've liberalized the diet stuff recently, so people are back to eating eggs now and drinking whole milk and eating butter. I went on margarine so long, and margarine is what's causing disease.
Oh, absolutely.
And butter is what's helping to cure it. It's incredible. It's incredible.
Fortunately, most people understand that now. There's very few people who don't realize that margarine is dangerous for you, at least from my experience.
Yeah.
But let's go focus on CoQ10 for a bit. I'm wondering if your studies have suggested an ideal dosage or range the doses for ubiquinol, since you're in agreement that the ubiquinol would be the preferred version.
Well, it depends on if you're a person who's having symptoms of, let's say, muscle pain. You're on a statin. You've been taking it for 2 months, and your legs are hurting terrible. In a case like that, I would say anywhere from 200 to 500 milligrams. But in a case where you wanted to use it preventively, I'd say not more than 200 should be sufficient.
Okay. Are there any other conditions, clinical conditions, other than addressing the side effects associated with statin drugs for coenzyme Q10? Do you recommend it as a general supplement to take?
As a general supplement, I said, well, I'm coming around now to just forgetting the statin thing and just thinking of the process of aging, and realizing that we really, anybody over the age of 50 is probably not synthesizing CoQ10. And their normal diets that we're on will not provide more than 1/20th of our needs of that CoQ10, unless you eat a lot of beef heart. Therefore, I'm getting to the point of recommending CoQ10 for everyone, starting at a very young age, as much as 40 or 50. I just have to research a bit more and see what the levels are at those, and see when the fall off begins in our ability to synthesize. But it comes certainly before 60. I'm thinking it's probably present somewhere between 40 and 50 as the fall off gets really significant.
Well, and my guess is it's largely related to the lifestyle of the individual. So if you have someone who's optimizing their health, and they're really leading a healthy lifestyle, that may not occur until they're 60 or so, where someone else who's smoking and drinking and eating junk food and processed foods, this may occur below 30.
Well, so, you're right.
I don't think it's a magic age related, just as long as you've been on the planet. It's really a time related effect of your exposure to many of these toxic influences that eventually impairs the mitochondria.
You're thinking that leading a toxic life is going to necessarily lower your CoQ10 synthesis. I don't know if that happens. I just don't
Well,
know.
it just makes
I'm
sense. It
not
just makes
saying it
sense.
doesn't, but I
I
just
mean, you,
don't
you
know.
see that with all forms of aging. You see
Okay.
people who are
Yeah.
60 years old and they look like they're 40, and you see another 30-year-old who looks like he's 60. I
Yeah.
mean, you
Right.
know, it's pretty clear. So, but I'm wondering from your experience about coenzyme Q10 and other neurological problems, something like Parkinson's disease or even Alzheimer's. Do you think that there may be some protective benefit there?
Yes, because I suspect that the cause is the same, mitochondrial, and I would go for large doses. And I would go for large doses in a person having persistent muscle pain despite stopping the statins. I would go for large doses because that means that it is mitochondrial, and you've got to go you've got to push, really push. Uh, it's not an easy subject. I'm assuming that if you are on a statin drug and you also are on CoQ10 when you start, I'm assuming that you probably would stay out of trouble. And
Well, at least we talked about this earlier. Is that's only 50% of the side effects. It has nothing to do with the
only
cholesterol
that
load.
that type of side effect for
Right.
50%. So
Right.
that's right. You're absolutely right. We did cover that. Yeah.
So now I believe CoQ10 has been recommended or used for certain types of cancers. I'm thinking of breast cancer specifically. Are you familiar with its usage in this area?
Well, the most recent article I was reading was very important. It had 41 patients who were end end cancer, end treatment,
End stage.
meaning that they'd gotten all the treatment they could
Mm.
possibly have. Their cancers were of about 7 different types. There were breast cancers, bowel cancers, brain cancers, everything you care to mention. And they put they put them treated them not treated them but put them on supplements with CoQ10 and a few other antioxidants and followed them along, and they gained some really remarkable longevity. Instead of dying in 12 months, which 50% of them was supposed to do, that same 50% lived for 28 months.
Hmm.
And this is basically because of CoQ10.
Interesting.
And I think we're learning a lot about CoQ10 and Parkinsonism and dementia from Alzheimer's uh, probably justify large doses.
Well, it's interesting too. I've recently became aware of one of the mechanisms, at least purported mechanisms of the way that we age, and that has to do with the telomeres, and those are the end caps on your jeans, somewhat similar to the hard piece of plastic on your shoelace. You know, they're really
Yeah,
relatively
I
small.
know telomeres, yes.
And the theory is that as your telomeres progress, I mean, there are 15,000 telomeres, base pairs when you're born, and they progress down to the point where there's only 5,000 at the time of death. And some researchers believe it's the most accurate biological clock. So that as any influence that will accelerate telomere shortening will shorten your lifespan. And my guess is that this coenzyme Q10, because it's such a potent antioxidant, is able to sweep up many of these free radicals, and as a result, probably prevent telomere shortening. And
An attractive theory.
yeah, I mean, we don't know. I mean,
Very.
no, I don't know if
Yeah.
anyone's looked at it, but it would seem to make sense.
But yeah, I've read this material and I agree with it. You have to agree with it, and because it's pretty objective. But yet, what is the actual mechanism that makes these telomeres become shorter and shorter and shorter? Uh, what's the chemical equation that's leading to this? That's what I need
Well,
to know.
there's a certain intrinsic basal shortening that can occur, but then there's also ways that you can be accelerated. Like I mean, we know certain toxins like smoking or lots of sugar, you know, metabolic syndrome, those will accelerate telomere shortening. So it's the same type of process. I mean, but there's a certain base that, you know, that's why people don't, at least at this point in time, don't live over 120 because, you know, it's at some point you reach that threshold, you don't have enough telomeres and you're dead. So. But it's some of the most exciting aspects of anti-aging medicine involve strategies to